I think it's safe to say that scopes are definitely a little bit different when you have a stoma. Hey guys, it's Maggie and I am back today, and for today's video we're going to be talking about scopes and stomas. This was a request that I got either on Instagram or on YouTube. I'm sorry, I don't remember, but somebody had asked if I could talk about colonoscopies when you have an ostomy, because things are a little bit different. I will say right off the bat though, having scopes prior to having an ostomy and then having scopes after having my stoma, I 100% prefer it the way that I do it now with my ostomy. It's a lot easier. That's my personal experience, and I really am going to be sharing mainly from my personal experience because, you know, I had the opportunity to prep a lot of kids as a GI nurse, prep them for their different scopes that they were going through. And I remember the medications and stuff that we gave and the protocol, but in comparing notes with other people, there are so many different ways to prep for scopes and just different policies and procedures and preferences per doctors, and also preferences for patients, depending on what works for you. So I'm going to share from my experience and kind of tell you how things went, you know, how they went down, and what it's like to be scoped with a stoma. I'm going to talk about the different types of scopes, because when you have a stoma, you have a whole new orifice that can be looked into. You got an extra hole there. So I'm going to talk about getting scoped actually through the stoma. I'm going to talk about what it's like getting a colonoscopy or a sigmoidoscopy when it's not connected to anything. I'm not going to talk too much about an endoscopy because that really didn't change a whole lot other than how the prep went, but yeah, we'll talk about all of it. Number one tip I can give you though is to get hydrated beforehand. I know the build up to having a scope, especially for the first time, it's nerve-wracking, it's scary, and you don't really know what to expect, and you don't know how you're gonna feel. And I'll tell you what, it's always the aftermath that gets me. I'm like, I just don't feel good. And the only thing that has helped me is making sure that I'm hydrated. And gratefully, we have Element as a sponsor today, which is a great way to get and stay hydrated. I know I talk about it a lot, but it is one of the, it has such an impact on my life. I just get dehydrated very quickly. It's something that I deal with every single day. And so something that I use every single day is Element. Guarantee it's in my water bottle that I bring around literally everywhere I go. And I think this is my favorite flavor, the watermelon salt. It's a zero sugar electrolyte without gluten, without food coloring, which is important for scopes, without artificial flavors. There's no extra stuff that you need to question and wonder why it's in there. It's also got 1,000 milligrams of sodium, 200 of potassium, and 60 of magnesium. And I personally found that this exact balance of electrolytes seems to hit the mark. I don't know, it seems to work really well. I seem to absorb it really well. And the thing that I'm excited about, okay, so I basically either drink Element in water, or I'm drinking some sort of seltzer or like sparkling water. I just really like the bubbly carbonation. Look what they got! Ah! Okay, so clearly I'm excited. This is the sparkling electrolyte water. I know, I'm so excited, and it's the watermelon salt flavor, which is my favorite. So let's give it a taste test live on camera. Oh, it smells good, and it appears to be clear. Yum. I don't know what I expected, but it's this bubbly. It's almost identical. That is really good. Oh my gosh. Okay, well, we're gonna be trying a bunch of those. The reason that I really like Element is just the flavor. It has been a long, like years-long battle of finding something that I will want to drink. If you don't like the flavor of something, you're not gonna you're not going to drink it. Simple as that. And this, it just is so thirst quenching to me because it tastes good. Not overly sweet, not overly salty. It's exactly what I like. And I'm hearing from a lot of you guys that you are enjoying it too. So right now, Element is offering a free 8 sample pack. That's the little packets that come in these, guys. Hold on, let me show you. You'll get 8 of these in a sample pack with any order of Element. This is a really great way to try 8 different flavors from them or share it with a salty friend. So to get this exclusive offer, go to drinkelement.com/LetsTalkIBD. That's DRINKLMNT.com/LetsTalkIBD. It is only available through my link. I know you're really going to enjoy these guys and all the different flavors that they offer. Thank you so much to Element for sponsoring this video. Let's talk about scopes. Okay, so I think, at least in the IBD world, I think one of the biggest things that we battle when it comes to getting a colonoscopy, getting an endoscopy, all these things, is the preparation. Usually you have to do some sort of bowel clean out. Like I said earlier, there's different medications that the doctors will prescribe you to use, and that's to help clear the bowel out so they can see with their cameras clearly. This, for somebody with a GI illness, it's rough because it can sometimes be a multiple day preparation in order to get like a 15-minute scope done, which is totally wild. But different people react differently to the medications, and sometimes they don't clear out as easily. The other thing about it is sometimes the things that they have you drink are voluminous, okay? There is a lot to them, and they usually say start at this time and drink this volume every so often, and you'll start going to the bathroom. And that's kind of miserable too, staying up all night in the restroom. Thankfully, I only remember going through this like rough preparation one time, and that was when I got diagnosed with Crohn's. This was like the diagnosis colonoscopy, and I was very young, and I had to do enemas, and I had to do the large volume of, I think it was Go Lightly My Butt, and I think it was, I forget, there was an oral like pill medication I had to take as well, some sort of laxative. And I know I didn't clear out very well. I was young and I didn't want to take the prep, and I was feeling really sick. It was just, that was a rough experience, especially to a young child. And then as we sort of started to learn that I had rectal strictures, clearing out in general, I was always constipated, so that just, they knew I couldn't do it. Like, it wasn't gonna happen. It was not long after that that I got my ostomy, and I think it's important to the experience that I'm going to share the anatomy of what I have going on. So I have an ileostomy, which means that my stoma is made from the terminal ileum, and then my colon, which I used to have for a while. I did have a portion of my colon removed, but I had a majority of my colon. And of course I had my rectum, which attached to the anus. So that's what I was working with, but it was detached from my small intestine. When it comes to Crohn's, that's the disease that I have. You can get Crohn's anywhere from your mouth all the way down. So it was important for the doctors to keep evaluating my bowel and, all of it. So going through the mouth, going through the stoma, and going through my bottom to get a good look at everything and see, where is the active inflammation. I remember the first set of scopes that I got after I had my ostomy, and my goodness, what a change. It was like night and day. And in a good way. And if I remember correctly, it was all three. So I was getting an endoscopy, I was getting my stoma scoped, which in my case is called an ileoscopy because it is an ileostomy, and then I was getting a colonoscopy. I think it was just a sigmoid flex because, yeah. And so it is a bit different when it comes to this because everything's kind of disconnected from each other. So for the upper portion, the endoscopy to the ileoscopy, I had to do a clean out. And this was my first round with this. So my dad, you know, I was still, I think, under 18. I was with my dad. He was like, we're gonna do it by the books because we need to make sure that you're cleaned out. And so we followed the time frames. The day before, I think I was on clears and I started prep, I wanna say around 2 to 4 p.m. The prep was a glass of Miralax. That's all it was. And so we did that and I cleared out within an hour. Yeah, which was kind of miserable. I learned that, yeah, I clear out extremely fast now because there's no, you know, I don't have any strictures or anything blocking, and when you give me laxatives, it just, it's gonna work. It's gonna work. And so what we were looking for is basically clear to yellow clear output, and I achieved that extremely fast, and then I wound up getting dehydrated because I had been NPO, nothing by mouth, for so long. When it came to the colonoscopy part, they had to go through my rectal strictures. And that, I will say, was the really tough thing for me. If you have any sort of perianal disease, getting a colonoscopy can be stressful because you kind of don't know how you're gonna come out of it. What we learned with my severe stricturing is that they often couldn't use a regular scope. I had been told that they would use a pediatric endoscopy scope to do my colonoscopy just because they couldn't fit the regular scope through the stricture. And at one point my stricture was, oh gosh, it was tiny, and it was fibrous tissue. So along with that, they would usually schedule a dilation of the stricture. They would perform that first in order to open it as wide as they could safely, and then perform the colonoscopy. And most of the time as a pediatric patient, I actually had my colonoscopies done in the OR. I didn't have it done in like a GI suite because of this stricture. Editing Maggie here. So early on when I was getting these dilations with scopes done, they did want me to try to clean out my colon with enemas, but we found out pretty quickly that I wasn't really able to achieve any results with that. I just wasn't able to pass the enema tip through my stricture. So that's why I don't really bring it up, because I didn't really prep my colon for these. There are some risks of perforating the bowel down there, and you know, that was a concern. So they can only really dilate so far in a GI suite. That is what I came to understand. And you know, waking up from these, normally from scopes where you're all connected, you know, sometimes you feel gassy and uncomfortable because they put air into your intestines to see better. You're uncomfortable, but there isn't too much pain. I would wake up with pain just because of my bottom. Having that dilation done, there would usually be some bleeding for me every single time. And yeah, that's kind of how that went. But here's the other side of it, because I know I said I 100% preferred that type of scope over being connected and having to get scoped. Even though it was painful in the moment, having them open those strictures allowed my colon, which still produced mucus at the time, you know, even though it's disconnected, there isn't food going through it, it still produces a bit of mucus that you have to pass. And every time that they would dilate me, yes, it would be painful for, you know, 2 to 3 days, but then I would feel a lot more comfortable because I was able to pass that mucus. So it was like, I'll take the pain to feel more comfortable for a few months. Now, of course, I'm not rocking that anymore. We got rid of that colon because it was a pain in the butt, literally, as I just explained. You know, I just had a lot of disease with my rectum, and it wasn't worth it to keep it, which I think was probably one of the best decisions. I know it's a major decision to go full proctocolectomy and have everything closed up, but at least nowadays I don't even have to get a colonoscopy because I don't have a colon. Very convenient. Now, let's talk about scoping the stoma. You may hear me refer to it as ileoscopy because that's what it's referred to for me, because that's my ileum coming out, but some people, you know, their stomas are made out of their colon. So terminology may change. I'm going to try to call it scoping through the stoma so it's more generalized. For this, so this is, I would say, the easiest. This was the easiest. Thankfully, if you have to do any prep for an endoscopy, this is what I've noticed. They always do my endoscopy with an ileoscopy now. Just knock them both out, check everything out. If you're prepping for an endoscopy though, your stoma scope is going to be prepped with it because, you know, the piping all connects. The first time that I had this, I was nervous because there's a few different things to be nervous about. Obviously, it's a little scary because I know that I had disease previously with my ileum. That was one of the sections that I actually had partially removed early on. And so, you know, there was a little bit of fear that they would find something, a little bit of fear that, you know, something's going into your stoma, and that gives me the heebie-jeebies. I actually have been probed, like I had my surgeon with a gloved finger, but you know, a finger, go through my stoma while I was fully aware and awake. It was totally fine. It wasn't painful for me, but I know that people who have stricturing or active disease, that could be really painful. So I didn't know what was going on in there. I was a little nervous about that, but you're usually asleep for all of this. So really, that was no problem. Once I woke up, there wasn't really any evidence that I had been scoped through my stoma other than my ostomy bag. That was my last concern. They have to remove your ostomy in order to scope your stoma. And so what I found really helpful for this is having a 2-piece bag, because most of the time they can leave your flange on. At least this is what they've done with me. They left my flange on, they removed the bag, and they scoped. And there wasn't any worry about them trying to change my ostomy bag and put it on wrong. I have had that before in other surgeries, and when I wake up from surgery and I see what the OR did to my ostomy, the way that they applied it, I'm like, what are we doing? So what really made me feel better though is I will prep a full new appliance ahead of time. I will provide all the supplies and I put it in a little Ziploc bag. Usually I will tell the nurse that's prepping me, like, hey, I have extra ostomy supplies. They're already cut to size. Everything is prepped, ready to go. I might even put a note in there if there's something special that I want them to do. But I tell the nurse that's prepping me for the scope, I've got this in case you need it. Also, if you remove the bag and you don't want to put, you know, a used bag back onto the flange that you're leaving stuck to me, there's a bag in there. You could just take that bag, clip it on, throw the old one away, because I know that can be messy. And I'll tell you, I did say that one time, and they put the old bag back on, but they didn't fully press it onto the 2-piece, so I woke up from the scope with leaking down my side. So that's a pain in the butt, but thankfully I noticed it and I was like, hey, what the heck? What the heck are you doing here? And so I wound up changing my ostomy before I left, and you know, there's nurses around, it was fine. But just that's something to be aware of. People who don't change ostomies every day are likely, and I'm saying this in the most loving, nicest way, they're likely not going to do the best job at changing it. And that's, I think, totally understandable. You've got a lot more experience with it than they do. I will say afterwards from these scopes, I usually don't feel well because the anesthesia that they give me, I don't know why. It makes me super nauseated. I get so sick to my stomach after most anesthesia, and I usually do throw up. Like after my ectopic removal this past spring, I was throwing up, and poor Zach. Like, I still had food in my stomach because I had ate earlier that day. It was an emergency surgery. I had eaten and I threw up everything I had eaten. Once I woke up from surgery, that was painful. But yes, sometimes the anesthesia can make you sick to your stomach. If that's something that happens to you, mention it ahead of time. They can give you medications to help with that. I have been given, you know, stuff like Zofran. I've been given patches behind my ear. I hate, what is it, scopolamine? Sorry, it's been a while since I've worked in the hospital, but the patch that they put behind your ear though makes you so dry, and since I have sinus problems, I will never use that again. That was awful. I felt like I couldn't breathe. But yes, they can give you medications to help, you know, make you feel a little bit better, and really just getting dehydrated is what happens after every scope that I have. Anytime I have to do any little bit of clean out with a laxative, I know that I have to hydrate ahead of time, which is why the Element is fantastic for that. Just make sure you're getting enough fluids, maybe up it a bit, because it really will help you in the recovery period. I'm telling you, test it out. Test it out. If you feel like you haven't hydrated well before scopes, before your next one, do all you can to hydrate and you will likely notice a difference. I bounce back way faster as long as I've got enough fluid. And it's funny because they'll usually, you know, set me up on an IV. They'll have a bag of fluids, you know, just gravity. As I'm waiting to go back to the room to get scoped, I'm like looking at the drip, and it's like drip, drip, drip. And I'm sitting there like, what am I getting, 15 milliliters before we get back? Let's open it up. That's sort of my experience. It definitely is way different. And now that I don't even have the colon anymore and it's just endoscopy, ileoscopy, it's a breeze. It is a breeze. I know. If, you know, you had everything you wanted, obviously you would have functioning bowels and stuff. But when it comes to specifically getting scoped, I feel like I'm fortunate. I just feel like I won the lottery there because, you know, healthy people eventually get scoped. My dad was getting scopes, and yeah, I think he was a little bit jealous of me not having to go through major prep and drinking all this stuff and having to sit in the bathroom all night. I mean, I got an ostomy bag. I can lay in bed for a while if I put on a big enough bag. That's my experience. I don't know if this was helpful or not, but this is just kind of what I went through, you know, prior to surgery and afterwards. Thank you so much for watching this video. And again, if you are interested in getting 8 single serving packets for free, different flavors from Element with any order, make sure to head to drinkelement.com/LetsTalkIBD. I know you're really going to enjoy them, and if you need to get hydrated, this is the way to go. This is how I do it every single day. All right, guys, I will see you in the next video. Bye, guys. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel, like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.